you. Hello, everyone, and thank you for your patience because, as you know, this is a live webinar presentation, and every now and then we have a technical issue, although it is rare. But I am super excited today because we have my good friend, Dr. Cindy Howard from the great state of Illinois, who is joining us today to talk about pre- and post-concussion nutrition. And there really isn't a better time to talk about this than right in the middle of football season, right? Well, if those of you on this call who may not be familiar with Cindy, she is an outstanding speaker. I've had the great pleasure of hearing her speak all across the state of Florida for the last year. And if she is going to be in a state near you, and we're going to ask her about that at the end of this webinar today, I really encourage you, do not miss her class. Don't miss her class because it is so informative. She's incredibly entertaining and fun. And this is really important information if you're really out there helping within your communities, working with athletes of all ages. She is just hands down outstanding. She earned her doctorate of chiropractic from National University of Health Sciences in private practice in Orland Park, Illinois, just south of Chicago, a board-certified chiropractic internist. I don't know why I was going to say that wrong. Board-certified nutritionist and holds a fellowship in acupuncture from the International Academy of Medical Acupuncture and is currently working on her diplomate in chiropractic neurology. She has a very extensive background and an incredible resume, and I really encourage you to click on the speaker background profile to read more about Dr. Howard. But since we were having technical difficulties and starting a little late, I'm going to stop talking, turn it over to Dr. Howard, and let her educate us today about concussion nutrition. Welcome, Dr. Howard.
Thank you, Christy. I am so excited. This is my first webinar with you and with ChiroHealthUSA, and I could not be more excited about spending the middle of my day with you and everybody else who's out there. So thank you for having me. This is great. I always have a ton of information that I like to share, so we are jam-packed for this hour with a bunch of slides to get through. One thing, if you don't know about me, you will learn, and that is I talk extremely fast. So if nothing else, I'm going to keep you all awake out there with lots of information we'll go through. And then at the very end, I am happy to hang tight for a little bit afterward to answer any questions you all may have. Christy did a really nice job introducing me, and rather than running through all my bullet points, you just see there some of my credentials. I will tell you at the very bottom is the one I'm most proud of, and that is the mom of 3 absolutely amazing kids. And Christy, you mentioned football season. I have 2 boys that play. We are smack in the middle of an undefeated season, which is pretty exciting. And it's very interesting because as I run around the country speaking on concussion, you know, I get a lot of feedback like, how could you let your kids play football when you are so educated in this realm? And it's a very interesting question because I worry more about my boys jumping out of the windows or the roof of the house when I'm not home, which I think boys tend to do, than I am about football with proper training and technique. And at the same time, we're just very cautious because concussion really does happen a lot, not just in football, but other sports, including lacrosse and baseball and gymnastics and cheer, and certainly just from playing. And there's so much more that we can do now, especially from a nutrition side of things, that are very interesting that you can incorporate into your practice. And what I'm truly hoping today is that there's at least 1, 2, 3 clinical pearls that at the end of this hour you can take and start utilizing in your patient base. And also remember, it's not just the athlete or even the weekend warrior that gets concussed, but it's our patients who are in accidents, motor vehicle accidents, work accidents, et cetera, that also can suffer from a concussion. So today what we're going to do is we're going to cover a couple things. One is really the role of pre- and post-concussion nutrition therapies. And we tend, right, as a medical population, a lot of times to treat reactively after something happens. But it's also very important in our world to think about the preventative aspect, right? So a lot of these things can be utilized in your patient base even prior to potentially getting concussed, which are also just healthy suggestions in general as well that you can implement. We're going to talk about how to prevent more severe injury, again, utilizing nutrition. That's the pre-aspect of this. And we're going to talk about some food and supplement recommendations post-concussion as well. And there's a ton of them that we can use. I picked some of my favorites and some of the ones that are very well researched and documented to share with you today, and we'll go through all of those together. So I want to start out with a story, and it's always very interesting when patients come through my office because they give me all my ammunition for when I present to give really good stories. And I had a young mother come in with her young son who was a youth athlete, and we were discussing some of her concerns with him, and we always review diets, right? So we go through a typical day's diet at least one day, if not more, to get an idea what they're eating. And I always ask to give me what you ate yesterday rather than a day in general, because people always pick their best day, and I don't necessarily want them to do that. I want them to give me a typical day. So this mother proceeds to go through her routine of her daily food schedule for her son, and we get to lunch. And she says to me, well, he will only eat a hot dog or a pizza puff. So I give him the pizza puff because it's more healthy. And under my breath, I'm thinking to myself, oh my goodness, I have my hands full, right? Because pizza puffs really aren't healthier. And I looked at her straight in the face and I said, you know what? Being that it's not really healthier, at least let him have the hot dog so that there's a little bit of variety. And then I chuckled and we discussed moving forward what proper nutrition might look like in best ways to help support this child that actually don't include a pizza puff and a hot dog, and some neat tricks that we can help children with to get out of their picky phase, if you will, because we as parents get sucked into that a lot of times to give in, and there's lots of good ways to get children out of that. So, you know, it's not necessarily the hot dog versus the pizza puff. It's really healthy versus unhealthy. And if we can start to mobilize our patients to eat better from a concussion standpoint, we're going to get much better outcomes, as you'll see in a little bit. So what exactly is a concussion? Real briefly, just to give you a definition, it's a clinical syndrome characterized by an immediate and transient alteration in brain function, including alteration of mental status and level of consciousness resulting from mechanical force or trauma. And again, it doesn't have to be just to the head. We've actually seen quite a few concussions last season in baseball from a blow to the body or a fall, which can occur as well. And then we have what's called post-concussive syndrome. And this occurs when we have side effects that are suffered after a head injury that may persist for weeks or months. And it's not uncommon for us to treat patients for a couple weeks. It's also not uncommon for us to see patients 6, 8, 12 months later still with some post-concussive symptoms as a result of either it's just taking a very long time, the severity of the hit, the fact that it might be their 4th, 5th, or 6th concussion, especially if they're involved in some serious sport, or even if they were misdiagnosed and it wasn't taken care of properly, which we get a lot of times too. Patients will then come in with lack of or poor treatment, and then we see them for weeks or months following. It's very sad, but a lot that we can do. So why is post-concussion nutrition really important? Well, we know that rest is no longer enough. You know, back in the old days, we put people to bed, we woke them up in the middle of the night, asked them their name, the President of the United States, and how many fingers we had up, and then we put them back to bed, assuming if they could do those 3 things, they were fine. Well, we know that rest alone is not the answer, and actually we don't wake patients up in the middle of the night anymore. We want to reduce inflammatory changes that occur, as well as decrease the chemical changes that occur in the brain and the rest of the body. We want to affect the neuronal function and provide neuroprotection, as well as provide blood vessel and tissue repair. But really, at the end of the day, what's the most important to the patient, and that is that we speed up their recovery, because they want to get back to school or back to work or back to sport or just back to daily activities without symptoms, and that's really what they're looking to do, right, as much as we want to affect the other aspects. And at the end of the day, we want to prevent further damage, because we do know that once you've received one concussion, you're twice as likely to receive a second, and after the second, you're 3 times as likely to receive the third, and the numbers go up from there. So the risk factor goes up dramatically once you've been concussed. This is a picture of one of my patient's MRIs, and this is where you're supposed to laugh. And I obviously can't hear you out there, so I'm just going to assume everybody's giggling a little bit as to my MRI picture. But this just goes to show you as a joke what it could look like, right, if our patients are not eating properly from a concussion standpoint, and what we see that can affect the changes in the brain. And I always joke that there's potentially one healthy thing in there, and everybody likes to guess, and they never really guess the right one. They think it's the smart food just because it's called smart food. But I always joke that it's the Funyuns, because I'm thinking that there was probably an onion in some point in its natural state before they made that product. And I am a big fan of the onion for lots of different reasons, but I guess once it's converted on the MRI picture, probably not so healthy. So we'll move on from there. At the end, I'm going to talk to you about a very successful case that I had in concussion, but I'm going to introduce you to him before we jump into the meat and potatoes of this 1 hour. And I'd like to introduce you to Daniel. So Daniel is a patient of mine. He's been a patient of mine for a very long time, and he presented to me at 19 years old with a new condition. And I had been seeing him for years anyway, but he is now a football player Current weight was 237 when he walked into my office, height 6'1", and you can see his vitals right there. And if you notice, there's two vitals in there that I'm not super thrilled with. One is the elevated temperature and one is the elevated blood pressure. The rest of his exam, when we do a physical exam in our office, was within normal limits, meaning we did a thorough exam, checked everything, and everything that we checked had nothing remarkable on it. He was concussed on the field. He is a linebacker for a college team in Wisconsin. And he was evaluated by his athletic trainer and returned to play after headaches went away. So that was his main concern. He came off the field with some headaches. After they went away, they put him back on, and they do some baseline testing there and certainly some repeat baseline testing on what's called a SCAT-3, which is an evaluation form in concussion. And those were obtained, and he passed. So he went back on the field. Well, when he came to see me a few months later, the headaches had returned, and he had elevated blood pressure and wasn't sleeping well. I asked him what his stress level is on a scale of 0 to 10. He gave me anywhere from 4 to 7. Told me it takes him about an hour to fall asleep, which is abnormal, and he wakes up at 3 o'clock in the morning all the time for no apparent reason, goes back to sleep. On Tuesdays and Thursdays, he's up at 5 a.m. to train, and on other days, he's able to sleep till 8, so a little disruption in his circadian rhythm. He does consume alcohol, completely admitted to doing that, even as underage. Headaches again, has some chest pain, his heart races. He was suffering from what he called self-diagnosed anxiety. They did do an EKG and worked up his heart, which is really important with the team physician, and that was considered normal. He complains of being lightheaded when he skips meals, has some afternoon fatigue, and actually wants to put on weight even at the 237 because for a lineman, that's pretty light. So I want you to think about Daniel a little bit as we're talking about some nutrition things, and then at the very end I'm going to show you what I did for him, how I took care of him, and how we helped the symptoms post-concussion a few months later. So let's get into those considerations, post-concussion and pre-concussion too. First thing that's really, really important is hydration, and there's been numerous studies to talk about how hydration following a concussion can speed up recovery. It also can help prevent a concussion. And what's very interesting to me about fluids, especially in our youth athletes, is they're not given a whole lot of opportunity to drink. So I know in our school system, they get about 20 minutes for lunch, and they spend a good 15 minutes of that talking. And the last 5 minutes, if we even give them a good water bottle to have for lunch, they're usually sucking down the food rather than the water. And we also are not necessarily in our school district, unfortunately, of having bottles of water or water access throughout the day. A lot of teachers won't allow it. We also, oddly enough, have a problem with kids trying to sneak vodka into water bottles. Yes, because it's clear, it doesn't smell, crazy, isn't it? But they don't always allow the students here to bring them in then from home because they don't know what they're sneaking in. So they're not getting a whole lot of hydration through the day, and then after school they're going right to their events, right? And a lot of coaches let kids, drink before practice and after practice. There aren't a lot of breaks, unfortunately. Hopefully your school districts are a little bit different than some of the ones we have out here, and we're teaching and educating to get that changed. But it's really important that we stay hydrated, and even in the adult population then in that world, hydration is equally important because we know moderate dehydration can significantly influence the self-report of symptoms commonly associated with concussion. And a lot of times that's what we're going on to, is what that patient gives back to us as far as symptoms. We will also see deterioration of the visual memory and increases in self-report of fatigue in those patients that are dehydrated through this particular injury. So what's the rule? Well, it's very interesting because we've always been taught in our internal medicine world to drink half of your body weight in ounces of water every single day. So I've been doing some, good old-fashioned Google and Medline searches, and it's very interesting because there is zero research to support that recommendation. And yet the more practitioners I run into, the more they say they were taught the same thing. So not exactly sure where we came up with that, and in full disclosure, I don't have the research to back this up, but it's what we're using in the meantime as a general rule. What's interesting, though, is there has been research done that talks about the fact that there is the possibility of actually overhydration, right? And it can actually put the body in danger of water intoxication and reducing sodium levels pretty drastically as well. And there are some studies that will say you should just listen to your body, right? So if you're thirsty, you should be drinking. And yet I'm not so sure I want everybody to be thirsty because at that point it's a good indication that we're not hydrated. So my recommendation is look at your urine. So you're going to pee, right? First thing in the morning, the urine is a little more concentrated than not, and it's probably a little darker yellow, and as the day goes on, that should get significantly lighter as you are drinking fluid. Well, if your urine is a pretty strong yellow color or certainly moving toward gold, you are probably not getting adequate hydration. You should see a light tint of yellow. If it is absolutely clear all the time, you are probably potentially overhydrated. So you can use that as a gauge. And it's interesting. I recommend in your office, get one of those lovely charts that show the different colors of urine and whether you're hydrated or not. Put it up in the bathroom so everybody can take a look. And if you're working with sports teams, we see those up above the urinals or above the toilets as well, which is great. And it gives the athletes a chance to take a look and get educated as to whether or not they're hydrated well enough. In general, you will lose 1 to 2 quarts of water per hour, and typically we drink less than we sweat. So with physical performance, it's especially appropriate that we replenish because we can get impaired with as little as 2% body weight. And if you think about that, on a 100-pound child, that's only 2 pounds. And I know having 2 boys who also wrestle, we're always looking to make sure we maintain weight. And sometimes, the kids eat a little too much, right, or overdo before they have to weigh in. And quite frankly, we can get them running, right, and urinating, and they can take 2 pounds off pretty easily just from doing things like that. So 2 pounds is not a lot. Pretty easy to lose that. With advancing dehydration, we also see increases in the heart rate and decreases in cardiac output. And as a result, our dehydrated players also heat up faster, which causes more dehydration, which will then drain your mental sharpness, your muscle power, and endurance. And think about this. If your sharpness, your power, and your endurance are now decreased, are you at more risk for injury/concussion as a result of those things changing? And the answer is yes. So we have a little bit of a circle going on between energy level, endurance, sharpness, dehydration, and then injury that's really important. So we want to make sure we keep our patients hydrated. There is some variability, of course. The temperature outside can play a role. Humidity, exercise intensity, sweat response to exercise. And again, remember where you are. So those of you that are in a higher altitude, it's going to be much different than my patients here in Chicago that are at a much lower altitude. As a general rule, we can recommend drinking 3 cups for every 1 pound of weight loss through sweat. And you actually want to try to replenish about 150% of your sweat loss because a lot of our patients will continue to keep sweating then even post any sort of exercise. And it's really important, too, that we try to rehydrate within 2 hours of that exercise stint. Also want our patients walking, right? So, again, that rest is not enough. We do want them moving. That doesn't mean go back to your sport. That doesn't mean, into the CrossFit gym. What it means is get up and move around a little bit. We want to increase walking to help stimulate the body. And what we found is when we combine walking with diet, it actually increases the success of regeneration in the brain, and we see a more pronounced healing process as well. We also know that those patients that are still consuming saturated fats, and we want that out of the diet, but if it's not, we know that exercise can counteract the effects of consuming saturated fat on the chemical changes and the inflammation in the brain. I throw out a couple extra things to think about here, too. What's interesting is when a patient is concussed, one of the areas we don't think much about, but we need to, is the gut. And it's amazing the incidence of infection that we see commonly in a concussed patient. And a couple things happen. One is something called intestinal permeability. And this is what happens when the lining, if you will, of the intestines get broken down, and some of the toxins from the things that we consume can leak through, in a sense, into the bloodstream, becoming a systemic issue. And that intestinal permeability is actually quite frequent. We've seen a huge link between concussion, which is, of course, a version of traumatic brain injury, and the intestinal changes. And we've seen it go both ways. So sometimes it's the concussed patient that has the intestinal issue. Sometimes it's the patient that already has a GI dysfunction that'll increase the symptoms as a result of the traumatic brain injury. And we see a lot of increased infection and worse brain damage as a result. And when we get back to Daniel, I'm going to show you how common that really is, because we did find that in his case when he presented. We also see that intestinal permeability can occur for at least a month after a traumatic brain injury, and I'll tell you in my personal experience, we've seen it months after that as well if there isn't resolution of symptoms. There's also a common thing that occurs in the small intestine referred to as SIBO, small intestinal bacterial overgrowth. We see this a lot post-concussion too. And one of the red flags with this is if you have a patient that's taking a probiotic, so here's your clinical pearl, if they're taking a probiotic and they feel worse with the probiotic, that is a sign that there is a potential for SIBO. If they are consuming any sort of sugar or carbohydrate and they feel worse after consuming it with abdominal bloating, burping, belching, reflux, and the potential of constipation and diarrhea, that is also the possibility of SIBO, and we can test that through either breath testing or blood testing to confirm or deny that the patient's also experiencing this to help with the gut. And I'm sure most of you out there have heard of the gut-brain connection. This is true with concussion as well. There's a very close relationship that we see, and when the gut isn't healthy, the brain certainly isn't healthy as well. Some other suggestions: we want to reduce calories. We certainly don't want anybody on a fast or not eating, but we don't want to overeat post-concussion either. We know that brain-derived neurotropic factor is very greatly affected in concussed patients, so reducing calories and eating consistently throughout the day will help raise BDNF levels that commonly drop post-concussion. We also know that nutrition within the first 24 hours is going to give us the best results, and we also want to supply the body with adequate protein. And this may seem like a lot for some of your patients, but for the next 2 weeks, we want to do anywhere from 1 to 1.5 grams per kilogram of protein for that patient in divided amounts. So if you take the patient's weight, divide by 2.2, that's how you get kilograms, and then you can dose accordingly for your patients somewhere within that range. The more severe, the higher I typically go on protein, and especially if there's some adrenal and fatigue issues, I tend to go a little bit higher on that protein in terms of that range. I mentioned a few minutes ago getting rid of saturated fats. That should be a given for all of our patients anyway, but certainly in concussion. And what's interesting is when we couple that with vitamin E, which is a really great antioxidant, we have seen reduced oxidative damage that occurs, and again, normalization of the brain-derived neurotropic factor in these patients that present. Other things we educate them on to stay away from are what's called excitotoxins. These are things that will activate the chemicals in the brain in a very negative way, resulting in symptoms such as greater headaches, brain fog, fatigue, memory loss, inability to learn new things. Sometimes it even results where the patient is then light sensitive and noise sensitive as well. So things like aspartame, artificial colors and flavors, yeast extract, caffeine, alcohol, hydrolyzed protein, sugar, and MSG should all be avoided always, but especially post-concussion, and that's where the pre comes into. A lot of these things we want patients to do ahead of time. There's also a lot of talk about the ketogenic diet. What's interesting is we've been talking about ketones for a very long time and putting patients in a ketone state post-concussion. And what's interesting about it is there's a lot of research now coming out showing that ketones are actually more efficient than glucose directly. And we know glucose is a very fast thing to give to somebody who needs energy in helping ATP production. But ketones have actually been more effective, as we've seen in the research. And in children, it works even better because younger brains are better at transporting and utilizing ketone bodies than the adult brain. We also know that it favors GABA production, which is a neurotransmitter that commonly gets affected, which can help. Ooh, I got a nice little spelling error there. Did you guys catch that? I said which can help instead of which, so I will go back and correct that. Can help with an increase in glutamate, which is also decreased with a concussed patient. And again, these have a profound effect from a neurotransmitter standpoint in mood and anxiety and depression that can follow a concussion. So when the patients exhibit those, you want to start looking at their neurotransmitter levels. There's research being done, and yet we have a long way to go, but this is a very fascinating picture I wanted to share with you. And the reason being is we can now determine that there are certain nutrients that can play a role depending on the area of the brain that actually gets affected. And you can see here there's a lot of similarities all the way through. For example, a lot of the areas of the brain will use magnesium and zinc and B vitamins, and we're going to go over a couple of those in a minute. But I thought that this was really fascinating and worth sharing, and I'm excited for more research to come so that when we know the area of the brain that's affected, we can be even more target-specific with the nutrients that we want to use. This study came out a couple years ago, which was also fascinating, and what they did was they looked at the mechanistic targets for nutritional therapies, which is also fun. So rather than just saying, hey, give this, hope it'll help, we can look at those types of factors that it actually helps with. For example, utilizing B6 for excitotoxicity and energy. We might want to use things like ginkgo if there's swelling, if there's edema. Quercetin we use a lot of, especially from an oxidative stress standpoint and inflammation, and the list goes on. And this is a fun chart. I get jazzed by stuff like this. It's pretty exciting to see how it breaks down and what we're actually trying to prevent or help with as we use nutrients, rather than just blindly knowing that we're throwing them at them because, Dr. Cindy told you to. So that's kind of a fun little chart. There's some interesting studies, too. Boswellia happens to be, I think, a very underrated supplement, and I use this a lot. Actually, every concussed patient that walks through my door typically will get thrown on Boswellia unless they have a problem taking it, and then we'll use Curcumin. Every once in a while, it doesn't work as effectively. There was a very small study actually done showing that Boswellia has a very profound effect on cognitive function during the period that the patients were on. So even though it was a small amount of patients, it was a very good study, and we've seen over the last few years it actually being used on a lot of NFL players as well to help them reduce the inflammatory effects after having any sort of axonal injury. N-acetylcysteine is another one of my favorites that I think gets commonly overlooked because it protects the brain cells from excessive damage and death, especially after any sort of ischemic injury, so even beyond concussion. Any type of brain injury this is great for. And the interesting thing is N-acetylcysteine is a precursor for glutathione, and glutathione is the best antioxidant that the liver manufactures, and we find that after being concussed, glutathione levels drop drastically. And it's very difficult to get adequate levels of glutathione in the body. IV nutrition is the best. Liposomal delivery orally would be the second choice, and non-liposomal capsules or even a topical would be my third choice, but the N-acetylcysteine will help the conversion in the body. So we'll usually supplement with that anywhere from 1,500 to 2,000 milligrams of N-acetylcysteine for the patient with no side effects typically. And this helps to reverse a lot of the behavioral deficits associated with the concussion or the traumatic brain injury as well. So great supplement if you're not using it. Fish oil, everybody's heard about fish oil, and this is a really important one. It's especially important because we've got the most research on this one, which is great, and we can back that up. There was a great study done actually quite a few years ago now, but it's very relevant, and it was published in the Journal of Neurosurgery. And what happened was they took animals and they actually concussed them, which doesn't sound lovely because they purposely did it, but I guess for the sake of science, every once in a while we close our eyes to that, but they took the animals and they gave them a daily fish oil supplement for 30 days. And what was astounding to me is the number in terms of the percent reduction, and they had a 98% reduction in brain damage compared with the animals that did not receive the supplement. So we also use fish oils in our patients. Fish oils, and there's lots of debate out there whether to use a 1-to-1 ratio, a 2-to-1 ratio, or a 3-to-2 ratio. I use probably more of the 3-to-2 ratio than anything else. I love to give fish oil with a meal, a fatty meal, because it absorbs better that way. I also would tell you that if your patients report that they are burping up the fish oil, it's usually one of two things. They either have a poor digestive system, which again could be the result of the concussion, or you have a bad quality fish oil. So just know that it's not the fish oil itself unless it's a bad quality. It could be a digestive issue. The other little clinical pearl and secret I would love to tell you, because most people don't dig into the research far enough, is to understand that if you give fish oils long-term, most fish oils are EPA and DHA only. And what's interesting, as much as short-term they reduce inflammation, long-term they actually can have damaging effects to create more lipid peroxidation. So if you're going to be keeping a patient on fish oil longer term, especially greater than those 30 days, I would recommend that you couple some GLA with it if it's not in your product. And if it's not, you can simply take about 100 milligrams of borage oil, put that with your fish oil, and that'll prevent the lipid peroxidation moving forward. And then there's curcumin, which I absolutely love as well. Curcumin is a great anti-inflammatory. There's been studies now to show it's even more effective than most NSAIDs out there, especially in the arthritis world, the osteoarthritis world. But we use this for traumatic brain injury as well because it reduces oxidative stress. It reverses the behavioral deficits in both locomotion and memory that can accompany a brain injury. and it actually also aids in synaptic simplicity and cognition. So it's a very powerful product that we can use. Certainly you can spice your food with it, you can eat it as well, but we use it in concentrated capsules or liposomal liquid forms. And again, I like the liposomal formulas. I think the delivery system on those are a little bit better. It gets to the patient a little more effectively, and we get them better a whole lot faster when we're utilizing curcumin in that way. And then there's vitamin D, which I also love. So we do a ton of vitamin D testing in our office. There's usually not a patient that walks through our door that we don't check levels. The research will talk about approximately 6,000 IUs a day for vitamin D because it increases the resilience to a TBI. So again, preventatively, pre-concussion, this is a really good product for patients to be on. And by the way, vitamin D is actually, it behaves like a hormone. It was misnamed when it was discovered, but it has hormonal properties. It's also extremely anti-inflammatory. It's great for mood. It's great for the immune system, which gets depressed after a concussion as well. And in combination with glutamine and even progesterone, it can work really well for moderate to severe traumatic brain injuries as well. Now, if you're checking it in blood, which I highly recommend, the typical lab range will be somewhere between 30 and 100. I like my vitamin D levels on my patients between 60 and 80, and I will shoot for a little bit higher in the concussed patients. And then I will typically repeat those blood tests every 30 days or so, 30 to 45 days, to make sure those levels are changing and moving in the right direction. So with a range of 30 to 100, I've seen patients as low as 7, and I may go up to 10,000 or 15,000 IUs then short term in order to get those levels where I want them. And if the levels are already pretty good, I may even go down from that 6,000 IU a day and only use 2,000 or 4,000 if they're in a really nice range of 60 to 80 when we run the blood work. So pre and post concussion, this is a really important product to have your patients on, regardless of where they live, how they train, and what they're doing. Vitamin D and progesterone. We've also seen in research a great recovery rate from severe brain trauma when using both progesterone and vitamin D rather than just progesterone alone or even a placebo. And here's a great study here that you guys can reference for that information. What's lovely about progesterone is we know that we have over 2 decades of research on progesterone, which is also great. So we're not just guessing. And the safety profiles on this is absolutely wonderful, and it's clinically relevant, and it's also pretty inexpensive and easy to administer. And we will use an average of about 8 milligrams per kilogram of body weight. So again, this should be dose dependent on your patients, just like the amount of protein you give. Take their weight, again, divide by 2.2, multiply that by 8 milligrams, and that's how much progesterone that you can use that's been shown very safe in these studies when we have a traumatic brain injury or a concussion. I keep saying that I have favorite supplements, but this is another one of my favorites, magnesium. Magnesium is one of those minerals that a good majority of us are also deficient in, and it's very hard to test for. So if you run a magnesium level in blood work, you want to order what's called a red blood cell magnesium, which is a little bit more specific, but at the same time, even the labs will report back it's very difficult to get an adequate level of magnesium in a test. Normal range will be somewhere between 4 and 8, depending on the lab. I like red blood cell magnesium to at least be over 6. Lots of signs and symptoms of magnesium deficiencies. I'm going to give you 4 that are very common, and that is muscle aches and pains, anxiety, headaches, and insomnia. And all 4 of those are very typical in your concussed patients. And it doesn't have to be all 4. It can be a couple. But if you're exhibiting signs and symptoms of those 4, there is probably a magnesium deficiency. Now, there's different forms of magnesium that you can take. And in the concussed patient, I have a favorite, and that is magnesium threonate. And I'm going to say that one again slowly, and I'll even spell it for you because I talk so fast that usually patients, when they write it down, or excuse me, doctors, when they write it down, they write down magnesium 3 and 8 because I say it so fast. But it's actually threonate, Threonate. And the reason that form is my favorite is because it crosses the blood-brain barrier, so it gets to the site of the injury to help replenish low magnesium levels. The other beautiful thing about it is it does not cause GI distress. which a lot of other forms of magnesium do in higher doses. So when a patient is given a magnesium citrate or glycinate, what will happen is as we dose up therapeutically, the body will not utilize all of that and excrete it in the fecal material, causing a diarrhea, and yet we need higher doses to get to the brain. So the magnesium threonate will allow us to treat appropriately with much higher levels, so that we also don't disrupt the bowels and now give the patient diarrhea on top of the symptoms that they already have from being concussed. Then there's zinc. Zinc is another mineral that can be checked in the blood work. Red blood cell zinc is what you would order, and we want to see adequate levels of zinc as well. Great study, 100 patients with severe head trauma between the ages of 18 to 65, so pretty broad in the way of the age. But the placebo was given versus 120 milligrams of zinc, and what we saw was when running inflammatory markers like C-reactive protein, ESR, SED rate, which is ESR, LDH is another inflammatory marker, changes in white blood cell counts. What we saw was those inflammatory markers of zinc, the inflammatory markers, went down with the use of 120 milligrams of zinc. If you are going to use zinc, I recommend doing that in divided doses, just because some patients, especially again with tummy trouble, who have a sensitive tummy, will potentially have problems with the zinc upsetting the stomach. So do that in split doses and you'll have less chance of stomach upset or any nausea associated with the zinc. And then there's plant flavonoids, which you saw in that chart too, and what's called anthocyanidins. And anthocyanidins are commonly found in blueberries. So when we made the recommendations to reduce calories, when we made the recommendation to keep people off chemicals and all of the junk food and adequate protein, one of my favorite snacks that we can use is actually blueberries. Half a cup of blueberries daily has a very high level of anthocyanidins in it. They're very anti-inflammatory, and that can be our treat, if you will. So I like that. We also love resveratrol, which can cross the blood-brain barrier. That is excellent to improve locomotion, anxiety, memory, etc. It'll help reduce post-traumatic neuronal loss and increase cerebral blood flow. There is a picture of wine there. I will tell you wine is probably not the best way to do that because we want to reduce the alcohol content, certainly in the concussed patient. Plus, you'd have to drink quite a few bottles of wine to get the amount of resveratrol that you would find typically in a supplement. So I'm sorry if I depressed anybody out there to take away the wine post-concussion, but let's do that and use it through supplementation instead. All right. So without breathing, I ran through a whole lot of information with hopefully some good clinical pearls in there and things that you can start implementing in practice. And now what I really, really want to do is I want to spend some time talking again about Daniel. So let's revisit a little bit. Daniel came into the office again post-concussion a couple months later with a return of headaches after he was returned to play by the head athletic trainer. For those of you that are not in the sports world, please know that in that world, it is the head athletic trainer that does make all of those decisions and chooses how to triage the patient. So he was triaged to the internist as well from a heart standpoint so that his heart could get worked up to make sure that everything was okay there. Because remember, again, we have high blood pressure, we have some chest pain, we have some anxiety, right? And there are some symptoms that could be very cardiovascular based in nature. So we wanted to make sure that was okay. Well, when Daniel came into my office, we decided to run some blood work. And this was his first set of blood work. Now, I use a computer program in my office that looks at blood work from two different ways. All the way to the right is the lab range. That's what the lab says is normal. And then you can see to the left of that I have what's called functional ranges, right? And the functional range is a homeostatic or subclinical range where we say, okay, the patient might not be clinically ill, but they are definitely not perfect, okay? So we look at both of those, and certainly if it's off clinically, we want to pay attention to that. If it's off subclinically, we want to pay attention to that too. So if you look here on the left-hand side, that's a lot of the things that I run in a typical test on my patients. And there were some things here that were drastically off I just want to share with you. One thing was uric acid. Uric acid is an inflammatory marker. It's also a marker that gets elevated in gout. It also can reflect digestive issues. So let's keep thinking. The BUN is low. That can indicate subclinically AP6 deficiency. And remember when I showed you that picture of the brain with the way we use some supplementation, B6 came up on that, okay, and it has a huge role in our neuro, so B6 deficiency. We've got sodium and potassium that are off a little bit, and that can indicate subclinically an adrenal dysfunction. And there may be some adrenal stress, which I'll show you, because remember, he can't sleep, he's got some anxiety, the blood pressure is up, he's waking in the middle of the night. These are all signs and symptoms of adrenal insufficiency. We can keep going. Alkaline phos is liver. That's a little bit high, not much. LDH measures cell breakdown. That's an inflammatory marker. That's high. The next two things, AST and ALT, are his liver enzymes. I don't like those. I want them under 26, and we know he's drinking. So, probably drinking more than the liver can handle at this point. His iron level is a little bit lower subclinically than I would like to see, and yet his TIBC is a little high, which means he's not binding his iron to his red blood cell really well. His red blood cell count's a little high. Hemoglobin measures iron within the red blood cell, so interesting there, a little contradiction, but that's okay. We keep looking and work this up. Walk all the way down, see white blood cells there. White blood cells, when they're a little low, that indicates a chronic infection versus when they're high acutely, it is an acute infection. And then here we look a little bit further. We've got monocytes, which are very high, which indicates a bacterial infection in the white blood cell count. We go down about a third of the way to where it says CRP, C-reactive protein. That's an inflammatory marker. I never want to see that elevated. And look, the range goes to 4.9. He's at 10.9, very high. His triglycerides or his fats are a little high, probably due to diet at college and the alcohol. His cholesterol is good at 158. I love that. That looks perfect. Even though his good particles a little on the lower end. We'd like to see that up a little bit. And if you work down, thyroid doesn't look too bad. His vitamin D level is a little bit lower than I'd like to see it at a concussed state. It's at 40. I like it between 60 and 80. And otherwise, the panel doesn't look too bad. Okay, so I tried to point out some things there that I'm looking for in terms of taking care of this patient. Next thing we did is we actually took a stool sample. I'm going to pause. This is where you guys are supposed to laugh again because you see how we collect stools on the right-hand side. Okay, I know, kind of not funny, but it's funny, right? Anyway, we do take a real stool sample. The patient takes the kid home, and they poop in a container 3 days in a row, or 3 days in a row that they go. Hopefully it's every single day. And we look to see what's going on in the gut to see if the gut is playing a role in this concussed patient with some of the symptoms. On the left-hand side, you can see expected or beneficial flora. That's the good guys. Those get rated anywhere from no growth to 4+. The two main ones that I always pay attention to, although I pay attention to all of them, but the main ones are Bifidobacterium and Lactobacillus. And you can see there he's a 4+ on the Bifidobacterium. He's only a 1+ on the Lactobacillus. So he's very low on one of the very beneficial good bacteria that can help fight infection. Under commensal or unbalanced flora, these are flora that are considered common to find in the GI tract, but I wouldn't say they're normal. And these can cause symptoms as well. He was a 4+ on alpha hemolytic strep. But what's even more problematic in this young man is he was 3+ on Citrobacter fundae. And this is a bacteria that absolutely does not belong in the gut. How he got it? Don't know. Could have been from contaminated water or food. In full disclosure, we don't know if he had it pre or post concussion, but we do know that it's there and it could be a contributing factor to his symptoms not getting better. Down below on the left-hand side, you will see microscopically there were a few yeasts that were found. And again, none to rare is normal, but a few is not good either. And what will happen when there's some yeast is that could be cravings for sugar, that could be brain fog, that could be low energy and sleep disturbances. There's a bunch of different symptoms, but in his case, it's probably playing a role for him too. Remember I told you that he said he wasn't sleeping well, took an hour to go to sleep, and he was waking up at 3 a.m. What I forgot to mention is that he was also taking melatonin every night, somewhere between 1 and 3 milligrams, but what was interesting is it wasn't helping him. So we ran a melatonin level, and even though he was out of range, it was actually high, probably due to supplementation. I don't believe that melatonin was causing this kid's problem with his sleep disturbance. I believe it was a cortisol problem. So let's take a look at his adrenals real quick. This is what's called the salivary cortisol and DHEA stress profile, and we look to see what his level of cortisol is in the morning, around noon, middle of the afternoon, and later in the day. And I'll just let you know, if you've never seen one of these, green is good. So we want his points, and you can see the measurements in those ovals there. We want those points to fall into the green section. And in the middle of the day, he's very high. Now, where most people might think, well, I've got extra cortisol, that's going to help me manage stress. It's actually quite the opposite. What that is an increased response where the body gets stuck in this heightened state where it's constantly fighting off fight or flight. So I equate this to, a young kid going into a haunted house, and we're at the right time of the year for that, right? So say you're walking through this haunted house, and it's like you just know that somebody or something is going to pop out and scare you, but you're not sure when or where, so your body is in this constant state, right, this defense mode, prepared to be frightened. And that's exactly what this feels like internally when that cortisol is elevated. And what's interesting is this is very important for stress. It is very important with excessive exercise and also alcohol consumption that we see this. His DHEA level on the bottom was actually perfect, right in mid-range, and this is really important for estrogen and testosterone production. This also gets synthesized from adequate progesterone, which I mentioned earlier in concussion too. So I was really happy with his DHEA level, not so happy with his cortisol level. He's under a constant state of stress. Now bear in mind, I will also tell you, even though it's not on here, being that he has been a long-term patient, a lot of these things are new for him. We've run blood work on him annually for a bunch of years. He's had some gut and adrenal testing as a young child done. This is new. This is new. So very important in this particular case. So what did we do? Well, we used liposomal curcumin, as I mentioned, as an anti-inflammatory. I put him on some fish oils for anti-inflammatory from the concussion standpoint as well. We did some really good liver support in the way of some herbs and some lipotropic factors that helped clear out the effects of the liver. And we did a little bit of gallbladder support because he was quite honest with me, saying he wasn't going to cut out the drinking, so I wanted to support that as well. I did a very broad spectrum antimicrobial product that I commonly use for the bacteria, the citrobacter that was found on the stool test. And then we actually used some GI detox in there too, which is a combination of clay and activated charcoal, which helps to mop up the bad guys once we kill it with the antimicrobial to pull it out of the body. We did some adaptogenic products that help with cortisol support. Even though that vitamin D was 40 in clinical range, I wanted it higher, so I put him on vitamin D. We used hawthorn and CoQ10 to help get that blood pressure down, along with a Chinese herbal formula for blood pressure that I like to use. And then we made some really good dietary changes. We increased his protein. We cleaned him up a little bit too, because again, he's eating, at college, which isn't always great. So we tried to get him on some healthier foods, away from the saturated fat, the junk food. Hard to do in college, but his motivation was there because he wanted to play football. And we talked about adequately hydrating him as well, which was important too, to make sure that the hydration wasn't preventing him from healing a little bit faster. So this was his blood work 6 weeks later, and it was really exciting to see what happened in the blood work. And I always like to remeasure. A lot of doctors will run blood, treat, and either keep patients on supplements indefinitely or just pull them off, or patients will discontinue on their own. But what I really like to do is repeat, because we want to make sure what we're doing is actually working on a chemistry or a physiological level, not just a symptomatic level. Because what can happen is the patients can come back, tell you they feel great, and if we actually haven't made those chemistry changes, then what happens is those symptoms a lot of times will return. So we want to see improvement. And this was really fun. So 6 weeks later, what happened? Well, we got improvement in that uric acid. His LDH went down. His liver enzymes started to crawl down, which was great. His ferritin, which was another inflammatory marker, went down. The monocytes are starting to come down. They were 22. They're now down to 14. The C-reactive protein also jumped down. Vitamin D went up. We're now in that 60 to 80 range. He was at 60 to 8, which I really like. And his iron is beginning to normalize. So just through 6 weeks of really good supplementation, reducing those food recommendations of all the bad stuff, and increasing his protein, we were already able to see pretty significant changes in the blood work. 6-week follow-up. Here's what he reported back. He was sleeping through the night because of using the adaptogenic products. From the adrenal standpoint, no more 3 a.m. calls, and he was able to have better energy throughout the day. His self-reported diagnosis of anxiety, he said, was greatly reduced, and I think part of that was just the fear of the fact that he still didn't feel good when he came to see me, and he wanted to make sure he was able to play without prolonged symptoms and to make sure that he could stay healthy while on and off the field as well. His monocytes and CRP reduction was huge for me because it showed that we were making headway on the infection. both in the gut and possible inflammatory change as a result of him being concussed. And then we got the elevation of the vitamin D and iron, and look at what his blood pressure was when he came back into the office, which is also fabulous. We had a blood pressure of 126/86, so we were getting right back to where he should be through good diet and through good supplementation. It's so interesting to me when we have patients present because we can have such a profound effect through food and through supplementation, even beyond our skill set in chiropractic or any other form of medicine that we may be practicing along with it. And when we couple these things, we see that patients get better much faster and stay better as a result of these things. Now, what would we continue to do with him from this point on? Well, we continue the supplementation until we get complete resolution with all of the blood work. We will repeat that stool test to make sure when he comes back, because he's out of town, he doesn't come home a lot, we will repeat that stool test when he comes back into town and make sure that that citrobacter is completely gone. I do not stop treating until I get resolution that way. And most importantly, right, besides what I want to see on the lab test, the patient is feeling better, and he's been playing and playing without symptoms, complete resolution of headaches as well, which is just absolutely phenomenal. And by the way, he did get adjusted. He gets adjusted by his chiropractic physician who is associated with the team, which is awesome, and he gets adjusted when he comes home here. I get my hands on him in order to help as well when he's not seeing the team chiropractor, which is absolutely great. The other thing I want to encourage is for those of you, whether you're in sport or not in sport, reach out to those athletic trainers that are working with these athletes in order to communicate with them and share how you can help, because they play a really big role, a very important role with these athletes because they see them day in and day out and can help monitor for you. And for those patients that you have that are concussed that aren't in sport, really important that you see them quite regularly too in order to assess these symptoms and make sure that they're getting the progress that you want to get and that they want to see. I leave you just with a quote that you can read there on the screen. I love this quote. I've been using this for a lot of times, a lot of years, and in a lot of presentations. And the reason being is because I think that proper nutrition is one of the most important things that we can do. I am absolutely convinced that 80% of my patient population would go away if we ate perfectly. Fortunately and unfortunately, I guess we don't. Fortunately for business, unfortunate from the standpoint that we're seeing sicker patients. We're seeing more patients that are suffering with inflammation and weakened immune system as a result of poor food choices. So it's really important. I want to leave you with one more little just tangent clinical pearl, something I share with my patients that I think is really important, and you're welcome to steal what I'm about to say with them to show how important food is, and that is, I don't truly care what my patients put in their body. I care that they're educated about what they put in their body. And there is a huge difference between food and manufactured product. Food is something you can fish for, slaughter, pick off a vine, pull off a tree, grow in the ground. It should spoil pretty quickly, and you really should have to shop for it or go for it a good couple times a week, right, in order to keep that up. Manufactured product is something that can live in your pantry for 2 or 3 years with an expiration date pretty far out. It's something that typically doesn't spoil. It will have additives and colors and all kinds of fun things added to it in order to keep it lasting longer, which is great from a business model and absolutely horrible from a health, inflammation, immune system, and concussion model. So I would challenge you to look at your patients and encourage them to continue eating food and eliminate as much manufactured product as they possibly can from their diet moving forward, both to prevent concussion, help get through concussion better if they are unfortunate enough to go through one, and certainly post-concussion in order to speed up the recovery. I thank you all for your time today. I really appreciate you spending this last, I think we're at about 55 minutes or close to the hour, so I will wrap it up so you can get back to your day and anything exciting you have. I am happy to open this up for questions as long as, Christy, you can help me get back to that screen so that I can see what I'm doing. There is my email, and that is my personal cell phone number. If there is any questions that I can ask or you don't want to ask in a group, or I can answer, I should say, or you don't want to ask in a group, if there is anything I can do to help your patients or help you help your patients get better, please just reach out, shoot me an email, send me a text or a phone call. I am happy to chat with you on any of the information presented or anything else you might have questions, in regards to this topic. again, thank you so much. This was fun.
Thank you so much, Dr. Howard. We do have a couple of questions. Who do you get your lab testing done by?
Oh, great. Oh, and thank you for reading them because I can't see them. So my basic lab testing, my blood work, there's a couple different companies. Locally, because in Illinois, they're regional, I use a company called Health Labs. But I also order through Lab and Quest, which are reference labs, and they're available all over the country, no matter where you're located. The stool testing that I do is done through a company by the name of Genova Diagnostics, Genova. That was the stool test. They also do my adrenal testing, the cortisol, the DHEA, and the melatonin. That's where those are done. I also use doctor's data. They do a great stool test as well. And I know the next question then will be like, which one do you use? And because, I can never make up my mind, I do fluctuate between both of them. I think both are great tests. They do measure the same things in a slightly different way, but I do get adequate results from both. Check them both out, see, what the price point is for you and the information that you get. And I always recommend having a little bit of an arsenal because sometimes I might recommend something and in your patient population you might not be getting exactly what you want. So it's always good to have a backup plan with a couple companies.
Do you have a bullet point sheet or some sort of concise recommendation sheet to study?
No. How is that for an answer? I don't know. Christy, do they have access to have these slides?
Yes. I can.
Okay, so at least you have that. Great question. Never thought about putting that together. I guess that's my next project, huh? I will see if I can work on that. Make no promises, but I'll see if I can do that.
The next one is, do you have a list of recommended supplements?
Maybe we need a little clearer question, like just a list of what I put in here. Is that what they're asking?
Maybe, yeah. Let me, for the person who asked this question, if you want to provide really quick some additional information. The last question was, what computer program do you use?
Oh, the computer program is through Apex Energetics for the blood work. They have a really nice one, and there's also one through Biotics. And if you take a blood work a blood work course through Biotics that they put on, the software is usually included. And they have a really nice program because they talk about the functional ranges too, the highs and the lows. And then we also teach that through the DABC program, the highs and the lows in the functional range, the internal medicine diplomate program as well.
All right. So do you have a specific brand of supplements that you use?
Oh, you know what, that's an awesome question. I stock over 600 supplements in my office, so there is not, in my opinion, there is not one company that probably has all of the products potentially that can be used. I use, and I'll just rattle off a bunch so you can hear them. I use Orthomolecular, I use Perk, I use Biotics, I use Integrative Therapeutics, I use Biobotanical Research, which is that biocide and that broad-spectrum antimicrobial that I use. Boswellia is where I get my progesterone from. I do my fish oils, again, through Biotics. Little bit of Metagenics. Trying to think who else I missed. I'm sure there's some that I miss. Specifically to this program, the vitamin D that I like is through Biotics. The liposomal curcumin is through a company called Numedica. The magnesium I use from a company called Zymogen, starts with an X. That's the magnesium threonate that I really like. So that'll give you a lot of good starting points.
Okay. And then the last one says, I have found that patients with total cholesterol under 165 have problems rehabbing the brain. What are your thoughts?
Yeah, actually, I would confirm that. Now, our range, and I love that 165 number, our range is typically 150 to 199. That doesn't mean it has to be, right, it doesn't have to be only 150. It could certainly be over 165. The other interesting thing about low cholesterol, which most people don't realize because it gets a bum rap for, just heart health, is that we actually need it on a mitochondrial cellular level. So we need cholesterol to live. We need it for energy. We need it actually for testosterone production too. So from an energy standpoint, if we're not getting enough energy, if we don't have the right tools to manufacture energy, we're definitely going to have trouble rehabbing the brain. So certainly anything I say under 150, I treat. I actually will increase cholesterol in the diet, and there's a great product called Sonic Cholesterol that I'll use if we can't get it up through nutrition. And certainly if patients are on statins too, we have to have a conversation back with that prescribing physician to relook at that, because they're driving, in my opinion, cholesterol way too low. So if you like the number 165, I'm on board with that. I like it somewhere between 150 and 199, and I would say even at that 150, if you're just not getting what you want, certainly allowing it to increase a little bit makes sense. So I agree. Great statement.
Wonderful. All right, ladies and gentlemen, just want to remind you that this webinar was recorded, not will be recorded, was recorded today, and a link to the webinar recording will be sent to you in the next 10 to 15 minutes. With that, you do have an ability, I'm trying to fix it right now, where you can download a copy of the handouts where it's like 2 slides per page, but this is a pretty large file. So actually it may be like 20 minutes. So I can compress this to make it easier to view, which is, she's got a lot of beautiful pictures in here. So it just takes a few minutes. So wait 15, 20 minutes. There will be a link. It'll say click here to download the handouts, and it'll download a PDF version so that you can read it. It'll be 2 slides per page, so it'll be about 25 pages long for the handouts, but you'll be able to see all of the information in Dr. Howard's slides. Thank you so much for being here today. I'm so excited about your inaugural webinar with ChiroHealthUSA, Dr. Howard.
No, this was fun. I appreciate you. Thank you.
And just real quick before we leave, because, again, she is a phenomenal speaker live and in person. Do you have any upcoming events in the next couple of months, cities that you're going to be in that you can let them know about so they have the opportunity to see you in person?
Let's see. I teach frequently for the Diplomate program in internal medicine. I'm in Kansas City, October 13th and 14th, and we're starting the program here in Chicago. If anybody has an interest in this work, they can reach out, email me, or text me, and I can get you the flyer. I am at IANR, which is an integrative neurology program in Phoenix, Arizona, October 24th through the 27th. I'm speaking that Thursday, the 25th. I will be in Las Vegas at the Pro Sport event on December 1st. And I don't know. That's all I can think of off the top of my head, and probably about 12 or 15 events next year. And as you mentioned, some of the Florida Chiropractic Association events as well.
Absolutely. Phenomenal speaker. If you do have the opportunity, you see that Dr. Howard is going to be in your state or at your convention, please take the time to go sit in her class. If you're interested in having Dr. Howard come speak at one of your events in 2019, you can email me at Christy@ChiroHealthUSA.com. Get with Dr. Howard and see what we can do for 2019. I want to thank y'all for joining us today. Thank you for allowing us to start a few minutes late due to technical issues. And the larger handouts did post, so you'll be able to access those in just a minute. Y'all have an amazing rest of your day, a fabulous week. For my Alaska providers, I will see y'all in 48 hours in Anchorage for your convention this weekend. Look forward to joining back with everyone here next week for our next webinar in the series. Dr. Howard, you have an amazing day, and thank you so much for being on our webinar series.
Oh, you too. You're welcome.
Bye-bye, everyone. Dr. Cindy, you